I am Dr. Subrahmanyam Nukala, a senior consultant of nuclear medicine, having worked in various departments in Nizam's Institute of Medical Sciences, Fortis, CARE and Omega hospitals in India and abroad also. Today, I would like to tell you about the role of nuclear imaging using SPECT or single photon emission computed tomography and positron emission tomography or PET studies in the management of heart failure. They play a vital role in establishing the cause of or etiology of heart failure and in managing such patients. Perfusion, metabolism, inflammation, fibrosis and misfolded amyloid proteins can be scanned using radio tracers which will attach to those particular things. The extent and severity of ischemia in coronary artery disease can be assessed using single photon emission computed tomographic SPECT scanning or using PET perfusion myocardial perfusion scans. We can estimate the extent and severity and plan the management. In patients in whom the ischemia or viability is less than 12.5%, medical management is advised, whereas in patients in whom the ischemic myocardium is more than 12.5%, revascularization is indicated with good prognosis. So, for this we can add FDG PET studies to accurately assess the viable myocardium. This is confirmed in the prediction of recovery after revascularization using PET studies. Then in patients, in addition to the role in coronary heart disease and ischemia, it is useful in microvascular dysfunction which commonly affects Indian patients and also in other categories. We also use these PET studies in the diagnosis of sarcoidosis. In sarcoidosis, the PET FDG scan is complementary to the cardiac MRI scan which is commonly done, which gives a lot of information. This FDG scan localizes in acute sarcoidosis and hence it is very accurate in diagnosing acute sarcoidosis. So, we have done a lot of patients in CARE hospital where we have seen that after starting treatment, there is significant improvement in the left ventricular function with disappearance of ventricular arrhythmic events by using CMR and FDG guided and then planning the treatment. Then we come to the amyloidosis. In amyloidosis also a PET and SPECT scans are very useful. PET scan is done using F18 fluor beta pair or C11 Pittsburgh compound, and they localize in both light chain amyloidosis as well as transthyretin amyloidosis. In order to diagnose transthyretin amyloidosis or ATTR amyloidosis, we have to do a SPECT DPD scan which is easily available in most of the centers. After diagnosis of heart failure, we have to know what is the risk of having sudden cardiac death or cardiac events. For that, a sympathetic neuronal innervation study has to be done using either I-123 MABG scan using SPECT camera or C11 HED or hydroxyephedrine scan using a PET camera. This can diagnose the event rate. If there is no uptake, that means the event rate is high, whereas if there is high uptake, that means there are less events, and this helps in planning treatment in ICD placement and in CRT, cardiac reconstruction therapy. Thank you very much.